Hello everyone. Joe Lewis has invited me to answer a question. What is a respiratory therapist? And while I answer this question almost on a daily basis for students that are interested in applying to our program, I'm going to bring that down to its very simplest form that I can think of. A respiratory therapist is a servant, and I mean that in its most noble sense of that word. Whether you're an educator, a student, a bedside clinician, whether you work emergency care, intensive care, home care, whether you're an administrator in the hospital, we are all there to take care of our patients, to improve their outcomes, and to improve their quality of life. But it takes three things to do that. Number one, it takes dedication. From the moment a student enters school throughout their entire practice, they have to be dedicated to render the best possible care they can to their patient. And that takes knowledge. It takes education. In school, we teach physiology and pathophysiology of the body, and we tie that in with skills that the students will go out and perform and become therapists and perform that respiratory therapy to the patients. Again, to improve their quality of life, to improve the patient outcomes. But education does not end at graduation. A therapist has to stay abreast of the literature and the research because the evidence is what's going to drive our clinical practice, what's going to enable us to give the best possible care to our patient. And the third thing that it takes to be a respiratory therapist is compassion. If you don't have compassion for your patient, you can be the most dedicated, the most knowledgeable person out there, but unless you have compassion, you're not giving the care to your patients that they deserve. Joe's coined the phrase, average is easy, and that's absolutely true. And if we work just a little bit harder, we're going to be above average. But if every single day, if every one of us, from educators to students to bedside clinicians to administrators in the hospital, if every day we come doing our absolute best, we can be exceptional. An exceptional therapist provide exceptional care to the patient. They improve patient outcomes, they improve quality of life, and they add value to our profession. So, yeah, the world needs more RTs, but I think we can do better than that. The world needs exceptional RTs, and are you an exceptional RT? I think it's a question we all need to ask ourselves. Can we be better? I'm really looking forward to continuing this conversation. If you want to add to it, leave me your comments. See you soon.